Patients with pulmonary hypertension have increased levels of inflammation. Inflammation causes a decrease in appetite, and patients who are often sick with pulmonary hypertension or other chronic diseases tend to have decreased appetite and gravitate towards calorie-heavy, carbohydrate-rich foods. Patients with pulmonary hypertension have been noted to have low levels of vitamin C, vitamin D, iron, among other micronutrients. It is unclear whether these deficiencies lead to the progression of their underlying pulmonary hypertension or are a result of their pulmonary hypertension and impaired diet. The American Heart Association, as well as other cardiovascular associations, recommend less than 2,300 milligrams of sodium per day, and that would also apply to patients with pulmonary hypertension. Sodium is very common in a lot of foods. Anything that is processed, canned, is high in sodium. We see it often in bread, pizza, cheese, but also can be a major component of things like pre-prepared salad dressings. So it's always important to read the labels, the nutritional labels, to be able to determine the amount of sodium in a diet. It is very important for patients with pulmonary hypertension to read the nutritional labels and determine the amount of sodium in the diet that they're consuming, because sodium is always associated with water. The more sodium you take, the more water your body will retain. Excessive water in the body leads to excessive fluid in the body that the kidneys might not be able to get rid of, and that could cause a strain on the heart, especially the right side of the heart. So patients with pulmonary hypertension are recommended to follow a diet that is low in sodium to avoid unwanted fluid retention. Too much sodium in the diet leads to fluid retention in the body. In normal circumstances, the kidneys should be able to excrete the excess fluid and maintain a normal fluid balance in our body. Patients with pulmonary hypertension are more susceptible to having kidney impairment that might not allow them to get rid of the water efficiently. Excess water in the body can lead to strain on the right side of the heart and worsen the symptoms of pulmonary hypertension. We recommend that patients with pulmonary hypertension eat a healthy diet, which encompasses large amounts of vegetables and fruits. We recommend that they eat a variety of vegetables and fruits of different colors, such as berries, greens, leafy vegetables, oranges, apples. We also recommend that patients with pulmonary hypertension avoid high salt content, as well as avoid high fatty foods, anything that is highly processed, cold cuts, because they are especially high in sodium, as well as avoiding other highly processed foods, TV dinners, anything that comes in a can, again, primarily because it is preserved with salt. Patients with pulmonary hypertension are often asked to avoid salt in their diet. However, sometimes we don't do a good job in educating them about the foods that they should be consuming. It is not uncommon that we see patients who try to avoid salt also avoid nutritious, healthy foods for them. It is important that we educate patients and give them alternatives that are healthy for them, that would conform to the low sodium diet, but would also have an appealing taste so that they are not left with poor choices. Pulmonary hypertension can be an overwhelming diagnosis with requiring the start of new medications as well as making adjustments to one's daily routine. Asking for a nutritional consult should always be an option for patients. Pulmonary hypertension care centers often function in multidisciplinary practices where patients have access to the physicians as well as advanced practitioners, nurses, social workers, and also nutritionists. So always feel empowered to ask your physician for additional resources.